Hi, I'm doing my GI Bleed med talks before I pass meds to Mr. Olson back here. So I have four meds ordered PO. We have ondansetron, which is Zofran. It's an antiemetic. Hopefully decreases nausea. It can have some side effects, including nausea, vomiting, diarrhea, GI upset, some dysrhythmias, and serotonin syndrome. That's because it works by blocking serotonin to disrupt vagal nerve stimulation. And so for serotonin syndrome, you're going to be looking for pale, shaky, sweaty, and then like your heart's skipping a beat. That one is given PO, and that one's safe to give PO. Normal dosage for that is 20 to 80 mg a day, up to 120. Next up, we have Prozac or what's the other name for that? Fluoxetine. Fluoxetine or Prozac. So this one is an SSRI. It also works by blocking serotonin. So you're going to be making sure for sure that you look for um, serotonin syndrome. Once again, it's pale, shaky, sweaty. Um, you, your heart's going to skip a beat. You're going to monitor the EKG before you give that one. This one also has side effects of GI. You're also going to take your weight weekly to make sure that you're not losing or gaining weight rapidly. And you're going to report that to your doctor if you are. Um, this one can also be given in unlabeled uses for chronic back pain. In our patient's case, it's for depression, but so it's an SSRI. Then moving on, we have amlodipine or Norvasc, and that is a calcium channel blocker. That works by stopping calcium from entering the heart muscle, and it slows down. It's a rate controller. So instead of having your heart go like this, it goes like this. Regular rate, regular speed, and that's what you want. So, couple side effects to this. It slows down your heart most of the time. So you're going to take your blood pressure and you're going to hold it if your blood pressure is low. You're going to hold it if your pulse is under 60. And you're going to monitor your EKG for changes to the heart rhythm because you don't want it to go into a fatal arrhythmia. For this one, you're also going to monitor your eyes and nose because this has fluid retention as a side effect. You're going to monitor your daily weights because you want to report a weight gain or loss of more than 2.2 pounds. You're going to monitor dental hygiene because your gums can recede from your teeth and cause gingival hyperplasia. And you're going to wear sunscreen because you can get sunburns a lot easier. It's photosensitivity. You're also going to change positions slowly because you can get dizzy, fall over, and hit your head, and we don't want that. Moving on, we have our final med, which is ibuprofen or Advil. And this one is taken for mild pain. Uh, no more than 3,200 mg a day. Don't take it for more than 10 days. This is an NSAID, non-steroidal anti-inflammatory drug. Greatly increases your risk of GI bleeds, GI discomfort, nausea, vomiting, and you're going to monitor pain to make sure that their pain's actually decreasing. But really look at that GI system. It works by inhibiting prostaglandin synthesis, which is something that rushes to sites when it's inflamed, there's infection. It does relieve moderate pain, but it greatly increases your risk for peptic ulcer disease. So, moving on to Mr. Olson over here. Um, we have our MAR, which I don't know if you can really see that. We have a MAR. So I'd come into the room. Hi, Mr. Olson. I'm Lisa. I'm going to be one of the nursing students taking care of you today. How are you doing? Okay. I'm sorry to hear that. Yeah, well, we're going to go ahead and try to get some meds for you, see if we can't get you feeling just a little bit better. So I'm going to go ahead and take your blood pressure and pulse and check on your EKG, and then I'll be back in a minute with your meds, okay? Perfect. Thank you. Pretend that I took his pulse, blood pressure, and checked his EKG. So in this simulation, his blood pressure is 88 over 55 off the top of my head. So I would collaborate with Doc because that's really low blood pressure and we don't want to drop that anymore. Uh, Collaborate with Doc, see if he still wants him to take the med. Calcium channel blockers you're supposed to take the same time every day to avoid negative side effects, to avoid dysrhythmias. So it's up to Doc what we're going to do with that. But for now, we're going to go ahead and pass it because within the purposes of the simulation, that's just what we're going to do. All right, so introduce myself to Mr. Olson. I'm just going to bring the MAR over here because I think that'll be easier. All right. Mr. Olson, can I get your name and date of birth from you? Oh, it's that date? Perfect. And can I see your wristband? Perfect. And I'd scan that into the MAR and double check that matches the name on the MAR. In this case, it does. Jim Olson. So first up, we have ibuprofen. Now that one's for your mild pain, Mr. Olson. So for this one, I want you to let me know if you have any sort of, I'd scan that. Do you have any sort of black tarry stools or vomiting that looks like cough grounds? If you're going to have any sort of different GI upset, just stuff like that, okay? And then I'm going to confirm this. It's ibuprofen, PO. 1 Hershey's bar. Now for Jim Olson. Perfect. And you said you do prefer to take those all at once. Beautiful. So next we're going to go ahead and do your amlodipine. This one's your calcium channel blocker, and I'd scan that into the MIR. And I'd check with this. Amlodipine, PO, now 1 Hershey's Kiss for Jim Olson. Perfect. And for this one, I want you to let me know if you feel dizzy when you stand up, or if you also need to be looking for stuff like sun sensitivity, so you're going to be wearing sunscreen outside, especially once you go home. You're going to be monitoring your weight and letting your doctor know if you're retaining any fluids. And then just if you feel that you're getting dizzy, you're going to lower yourself to the ground pretty slowly. Just try your best not to fall. And then we have ondansetron, PO, now 1 gold coin worth. Now this one's your antiemetic, so hopefully this one makes you a little less nauseous. If I can get it out of the wrapper. There we go. Alright, so this one works by blocking the serotonin at your nerves, so it can cause something called serotonin syndrome. You're going to let me know if you feel shaky or weak or sweaty, and then your heart feels like it's skipping a beat. You're also going to let me know if you get any new skin rashes. And next we have fluoxetine or Prozac, PO, now 1 Yorkman. Alright, this is your SSRI, and this is the one you take at the same time every day, just like your amlodipine. You take it at 3:30 every single day. And you can't stop taking this one suddenly. It works by increasing the amount of serotonin that stays in between your nerves, so that way it soaks into your body a little better. Or that's the hope, anyways. And for that one, you're gonna let me know about your serotonin syndrome. You're gonna let me know if you get weak, sweaty, your heart feels like it's skipping a beat, anything like that. Okay. And give your doctor a call before you want to stop taking this med, okay? Because you have to wean off of it slowly. You can't just stop taking it. Right, I got that cup med for you. Would you like to hold that? Perfect. And here's your water cup. Perfect. I would come back 30 minutes later and just check on the patient, make sure that I haven't made any errors and that they're doing okay, and assess for whether or not the meds have actually started working or not. Come back, check on his pain, check his blood pressure, pulse again maybe. That's about all I have for you. I'd sign off the MAR, but there's no way to do that on my computer. Thank you much.